So good afternoon all. So today we will be discussing about empyema. So what is empyema? Anyone? So empyema is the collection of pus within the pleural cavity. So before we discuss about the empyema, before that, can anyone tell me what is the pleural space? What is visceral pleura, parietal pleura, and what is the pressure within the pleural cavity? So before we discuss the clinical presentation, diagnosis, physiotherapy management, we must know about pleural cavity. So pleural cavity or pleural space is a space between the visceral pleura that covers the lungs and the parietal pleura. So visceral pleura is the inner lining of the lung and parietal pleura is the outside lining of your lung. In between it, the space in between parietal and visceral pleura is called as pleural space. The cavity within the pleural space is called as pleural cavity, and this cavity contains a fluid called as pleural fluid. Is this much clear to everyone? Okay. So as there is a fluid in the pleural cavity, that fluid must be exerting some pressure, for sure. So what is the pressure within this pleural cavity? Is it a negative pressure or a positive pressure? Anyone? Is it a negative pressure or a positive pressure? You can very well see these are your lungs, this is your lung, and this is the outer covering of your lung. So the pressure within the pleural cavity should be a negative pressure or should be a positive pressure? It should be a negative pressure as compared to the atmospheric pressure. Because if it will not be a negative pressure, then how will your lungs expand? You all know tidal volume breathing, normal breathing, breathing in and breathing out at your normal respiratory rate, 500 ml of tidal volume. So this tidal volume breathing we are able to do because of this negative pleural pressure. Because when the pressure is negative, it gives space for the lung to expand. If that pressure will be positive in nature, then just imagine how much effort your lung or your respiratory muscles need to do in order to expand. Can you all understand? One student, come here. So I'm just giving you an example, okay? Just to understand the negative and positive pressure. Okay, suppose we are not talking about the respiratory muscle. In general, he is flexing his neck, right? Okay? Now he has to extend his neck. Now if you apply a positive pressure, how difficult is it for him to straighten his neck? Is it difficult? Yes. Now if I will make that pressure negative, less impactful, then easily he can extend his neck. Right? In the same way, when the pleural space pressure is negative, less compressive pressure, then your lungs can expand easily. Is it clear to everyone? Second thing is that if there is a positive pressure within the pleural cavity, if it is not negative, maybe he'll be able to extend his neck. But then it will involve lot of strenuous work, lot of work of muscles. So the work of muscles will increase, of respiratory muscles will increase if there will be a positive pressure. Now can you understand? So that negative pressure helps us in maintaining a normal tidal volume breathing. Now if this negative pressure becomes positive, then what can happen? Empyema is all about that. Whatever clinical features we will be discussing in empyema, that will be based on the conversion of this negative pressure into the positive pressure. So imagine now that this pressure in the pleural cavity has become positive, means it has become like a compressive pressure. Now what will happen? Sorry? Tidal volume will decrease. What else? Sorry? Accessory muscles usage will increase. Work of breathing will increase. Now, because your lungs and your respiratory muscles have to work extra against this positive pressure to attain same level of oxygen in your blood. Right? You all are able to understand this much? Okay, so now we will come on this later. So, empyema is the collection of it is the accumulation of thick pleural fluid within the pleural space, often within fibrin development. So now, in your pleural space, the pus pocket has come. Okay, so pleural fluid is replaced by thick purulent fluid, that is called as empyema, also called as pyothorax. Is it clear to everyone? We'll revise again. Parietal pleura, visceral pleura. In between both the layers is a space called as pleural space. Within that pleural space there is a cavity called as pleural cavity that contains pleural fluid. That pleural fluid got negative pressure, then that helps in the normal tidal volume breathing, which is 500 ml. If that pressure turns from negative to positive in any disease condition, then that will result in lot of clinical symptoms in a patient. Okay, so empyema is one such condition in which due to many reasons the pus gets accumulated in the pleural cavity, the pressure turns into positive and then patient starts showing lot of symptoms. We will discuss about that. Okay, clear? Now we will, before coming on to the clinical features, let's talk about the causes. What could be the reason? What could be the causes of pus accumulation in the pleural cavity? Anyone? Just think. Infection. Infection could be a viral infection and it could be a bacterial infection. Any infection can travel up to the pleural cavity and cause accumulation of pus over there. Okay. So bacterial infection could be pneumonia, tuberculosis, and there are a variety of other bacterial infections. Viral infection, like in COVID also, coronavirus was a viral infection. In that case also, patient can get a pus in the pleural cavity. Apart from the infections, what else could be the causes for empyema? Can it be traumatic invasion? You understand traumatic trauma? How trauma will lead to empyema? Anyone? Anyone of you? Anyone? Come forward.
Due to trauma, there is a leakage of fluid from lungs into pleural space.
Okay, he's right. He says because of trauma, there could be the direct. If there is a direct trauma to your chest wall, okay, then it can directly cause rupture to the pleural cavity, or sorry, to the pleural layers and cause an injury over there. Whenever there will be an injury to the pleura, what will happen after every injury? What takes place? Inflammation and a local flow of the inflammatory markers over there. Remember, there will be swelling and collective pus formation will be there. You know about this pathology? अगर आपको एक कट लग जाता है हाथ में तो उसमें क्या होता है? सारे वो ब्लड निकलते हैं, वो ब्लड क्लॉट होता है, स्वेलिंग आती है, सारे इंफ्लेमेटरी मार्कर्स आ जाते हैं वहाँ पे आपके, राइट? देन उसके कुछ टाइम बाद वहाँ पे क्या बनना शुरू हो जाता है? या तो पस पॉकेट बनना शुरू हो जाता है या एक स्टार्स हीलिंग स्कार फॉर्मेशन होनी शुरू हो जाती है. तो सेम happens in your lung also. Very good, beta. So one could be the direct injury to your chest wall that can damage your that can cause damage to your lung pleura. Another thing could be, another traumatic cause could be the rib fracture. Yes or no? Rib fracture. So what rib fracture? Rib fracture, if there is an unstable rib fracture could be a hairline fracture also, and it could be a unstable fracture. Means two fragments are not aligned with each other. They are displaced. So that sharp bone can also cause rupture to your, can cause injury to your lungs and can lead to empyema. Okay? So these are the traumatic regions. Iatrogenic causes. Who will explain me the meaning of iatrogenic causes?
That is caused due to any medical person during surgery. Due to medical person during the surgery, any mistakes done by the medical person may be affected.
Okay, he is absolutely right. So he is trying to say the iatrogenic causes means that during any invasive surgical intervention, if there is rupture to the layer of the lung, that is called as iatrogenic injury to the lungs. Can you understand? No? Have you ever seen sometimes while taking blood from your vessel, there is bluish discoloration? When someone is trying to take the blood from your vessel, sometimes the vessel gets ruptured if the needle is not inserted correctly, right? Sometimes, they inject a needle inside your lung, in between your intercostal space to take out the fluid from the lung. If that invasive procedure is not done correctly, it can cause damage to your layers of your lungs. That is called as iatrogenic causes, accidental causes. You must have seen, you all go to the ICUs, so you must have seen there many patients are present with the intercostal drains, tubes to discharge the blood or the pus from your pleural space. Have you seen that? So that administration of the tube should also be done very correctly, otherwise that can also become an iatrogenic cause of injury to your lungs. Is it clear? So in major categories, if we talk about the causes, it could be any secondary infection or traumatic invasion or any iatrogenic cause. Okay, is it clear? Right? So thoracentesis, what is thoracentesis? Thoracentesis is a procedure. It's a procedure in which a needle is inserted in your pleural space to take out the fluid to check whether the pus is because of the viral infection or because of the bacterial infection or is there any other fluid. Okay, that is called as thoracentesis. Is it clear? Now I just would like to ask one more question. How will you come to know? We are coming on the clinical presentation of the patient who got empyema. Okay, so before that, okay, what will be the clinical presentation of the patient who got empyema? Anyone? Now you know the causes. Fever, yes, fever, shortness of breath, cough with expectoration, and hypoxia, What else will be the clinical presentation of a patient with empyema? Shortness of breath is done. Okay. So, a patient of empyema can come into different stages to you. Okay. So, as we know that it could have a bacterial or any infective origin. So, initially, maybe a patient that is coming to your clinical setup is only coming with fever, chills, fatigue, laziness, because if it's an infective pathology, if it's an infective pathology, these are common signs of any infection, right? Lethargy, loss of appetite, these are the common clinical symptoms of a patient, okay, who got any infective pathology. Along with this, if it is empyema, now because the pressure is converting into the positive pressure, patient will have difficulty in doing the tidal volume breath. So patient will also complain of pain in the chest. That will be one again classical symptom. The patient will say, डॉक्टर साहब जब मैं सांस ले रहा हूँ तो मेरे छाती में बहुत दर्द हो रहा है. ठीक है? At this point of time, patient has come to you and patient doesn't know that he got empyema. Okay? So as a physiotherapist, you should be able to diagnose it at least, or you should be able to guide the patient for the diagnostic test or to go to the concerned clinical specialist. Okay? So patient will come with the chest pain as well. Okay? What else could be the feature? Pain, fever, lethargy, chills. Hypoxia will not come immediately. Hypoxia will come in the later stages. What else could be the symptom? Patient will have difficulty in breathing. Right? Dyspnea, you all know about dyspnea? Dyspnea is difficulty in breathing. Patient will be walking and then patient will take pause in between and like, डॉक्टर साहब थक गया, ज़्यादा चलना नहीं जा रहा. So patient will be short of breath. Okay, fine. What will happen to the respiratory rate? Will it be more or will it be less? The respiratory rate will increase and the depth of breathing will become shallow. Right? Why the depth of breathing is shallow? Shallow breathing means, okay, normal breathing means, deep breath means, shallow breath means, because of the positive pressure, because of the pulse, patient is not able to expand the lung completely. So patient will take short bouts of breathing. Right? That short bout of breathing will be shallow breathing. So, shallow breathing. Now, initially, when the patient was doing a normal tidal volume breathing, a particular amount of oxygen was going inside. Yes or no? When you do the tidal volume breath, some oxygen concentration goes inside your blood and carbon dioxide comes out. Yes or no? Okay, now patient is not able to do that tidal volume breath. From 500 ml, imagine that has become 200 ml or 300 ml. What will happen to the oxygen concentration that was going inside? It will also become less. Now, in order to compensate for that, patient will try to take frequent breath. So, respiratory rate will increase. So, increase in the respiratory rate is a compensatory mechanism of the body to compensate for the deficiency in oxygen. Is it clear? Clear to everyone? Okay? So in initial stage, patient was just lethargic, just normal infective symptoms. By the second time, when it got progress, patient started developing compensatory mechanism of increasing respiratory rate. What will happen to the heart rate? Any question, madam? No, you can ask. Is there any question? Hanji. What will happen to the heart rate? Heart rate will increase. That is called as tachycardia. Okay? Fine. So tachycardia is increasing your heart rate. Now why that increase in heart rate is taking place? Because initially if you have any infective pathology if you got, that results in increased metabolism, right? And metabolism means the demand of the oxygen in the body increases because your body has to fight to get rid of the infection, no matter wherever it is present. So the body will try to work over, and for that body needs more oxygen. And already patient is in a shallow breath, patient will not be able to deliver that much oxygen. So now the heart will come into play, and heart will try and pump more to compensate for that oxygen deficiency. Is it clear? So apart from that, later on in the later stages, patient can develop a collapsed lung also. Patient can develop wheezing, crackles, cough, maybe blood in the cough, and ultimately patient can land up into the ventilator as well if the initial signs and symptoms were not taken care of. Right? So you all are clear with the clinical features? Clear? Okay, so what about the diagnosis? What will be the diagnosis for empyema? Chest X-ray. But before chest X-ray, CBC. Complete blood count. Okay, that will help you to know whether there is an infective pathology or not. Chest X-ray, chest CT scan, chest MRI, thoracentesis, in which needle is inserted. So these are few of the diagnostic tests that you can carry out. Okay, now what will be the physiotherapy treatment or physiotherapy goal planning for this patient, for an empyema patient? So that we will discuss in the next class. Okay, the physiotherapy goal planning and management for the empyema patient. Thank you so much.